So, hello everyone. In this webinar, we will be discussing data protection law in light of the recent COVID-19 pandemic. During the outbreak of the COVID-19 pandemic, it has been widely observed that public and private organizations adopted various measures to mitigate problems that affected their employees, their customers, and other stakeholders. Such businesses and organizations have attempted to carry on business as usual practices and have unavoidably been faced with the reality of processing new forms of personal data, such as health data. And this data, in many cases, may concern health statuses of individuals sharing a workplace environment, or it may concern results of a test, the test results of a COVID-19 rapid test or molecular test. Body temperatures, travel plans, and location history also included in such data. Such is the case where it is very clear that the information is very likely to be classified as personal data, or it may fall under the special categories of personal data, which are subject to much stricter compliance requirements under the new GDPR. The intention of this video is to discuss with a professional in the sector navigating the GDPR rules during this pandemic and ask how they have managed to ensure that the processing of personal data is still carried out lawfully and in line with the general principles of the GDPR. And that's why I'm very happy to welcome and introduce Ms. Hadjitheodoru, a lawyer and expert with expertise in data protection, acting as a DPO in a pharmaceutical company that will help us navigate this new era post-GDPR. So Ms. Hadjitheodoru, hello. Thank you for joining us.
Thank you for the invitation.
I'd like to start immediately and ask you, based on your experience and with the expertise that you have after the GDPR, how has COVID impacted data privacy in the pharmaceutical sector, and what are the main threats?
Well, obviously, Katerina, pharmaceutical companies process a plethora of data stemming from clinical trials, medical research, and healthcare professionals, of course. Now, in times of COVID-19, companies must ensure the health and safety not only of their employees, but also their customers or perhaps visitors, probably affected by infected personnel. Now, in this context, we've seen two main trends emerging: remote working and digitization, both raising significant risks to data privacy and, of course, security. Recently, we have seen a rise in cyber attacks, and we have witnessed cyber attacks aiming at pharmaceutical companies that develop either vaccines or COVID-19 tests. Furthermore, we have also seen that new processes such as video conferencing are implemented perhaps too quickly without proper vetting, controls, or other processes in place. Last but not least, IT systems and workforces are seen that they're stretched to respond due to the pandemic, also resulting to a high risk to privacy.
You mentioned teleworking. How can pharmaceuticals safeguard their employees' privacy and data protection during this time, and especially during teleworking expertise?
Well, teleworking, at least in this level, is a new reality for many companies. But I also believe, Katerina, that once the pandemic ends, teleworking is likely to continue. In other words, work from home is here to stay. In this case, I think it should be advisable for a company to update or draft a work from home policy and also update any relevant documentation such as information security policies. Of course, they should check their IT systems, make an assessment of privacy risks, and adopt any relevant technical and organizational measures. Now, if I could offer perhaps a few tips on working from home, I guess that would be to use VPNs, which are company authorized, to ensure physical security of your device, whether that be a laptop or an iPhone or a tablet. You should change your passwords regularly, and of course, try not to share them with friends or members of your family. And another, perhaps not privacy related, but equally important advice, I think that would be to try and define your workspace, to distinguish working from home and staying at home. Find a place inside your house you can go to and be undistracted.
Of course, that has been observed, and it's been difficult for many people during this new type of working. Regarding the new types of processes that you were saying, such as body temperatures, what do the companies need to be aware of?
Well, this is a very important issue, and the proof is that a number of regulatory authorities around the world have issued detailed guidelines on this matter, and of course, the Greek Data Protection Authority is no exception. Long story short, I think all basic principles of EU law apply here. Principles such as proportionality, necessity, and of course, data transparency. Regarding employees, I think, especially employees that might have tested positive, I think that companies should try and avoid naming names. And when it comes to visitors, companies should exercise perhaps some extra caution not to retain, for example, their temperature data. Also, in this case, conducting a data protection impact assessment would be a good idea in order to mitigate risk and take any necessary organizational or technical measure.
Thank you for that. And a lot of companies, I think, will be in need of such information and guidelines. One final question. Do you think that after COVID-19, we should be looking at privacy in a very different way?
Well, I think first of all, we should mention that privacy and health aren't opposites, aren't enemies. They are two fundamental, of course, human rights that we should try to reconcile. As mentioned before, COVID-19 pandemic has required companies to adapt quickly to new technologies without really doing a background check on them. So after this crisis is over, I think that companies will need to perhaps seek consent, explicit and voluntary given consent to ensure that any ongoing processing of data is in compliance with all privacy laws. And of course, as mentioned, they should verify technologies or processes such as video conferencing or digital verifications to avoid potential non-compliance with privacy or security violations. Bottom line, Katerina, I think that with or without, of course, COVID-19, you always have to follow the law, privacy law, labor law, EU law. The rules are here. We just have to comply with them.
Of course. Thank you very much for your insightful input. It would be very useful for a lot of companies and individuals working in the health sector to hear with your expertise, the experience that you have had and apply it to their own cases. So thank you very much. And I hope that you join us soon in another following webinar.
Thank you. Bye-bye.
Thank you.